So it's very nice to be here. Been here in Israel for a few days and visited Jerusalem and Galilee and now here, a very beautiful country. So lucky to live here. And as we said, I'll talk about particulate matter air pollution, something I've worked on since my dissertation at Harvard long ago. So just as an overview, I'll discuss the nature of particles, which I'm sure some of you are familiar, but just sort of generally. The health effects of particles in general, and then talk a little bit about, from the global burden of disease work that we did, our committee, the global extent of the particulate matter problem, and then get into the climate change mitigation policy implications of particles and their control. Particulate matter air pollution is composed of particles of two types. I mean, they're very mixed, they're a great mixture from different sources, different characteristics, but one of the ways you can break them down is into primary particles, which come directly out of exhaust pipes. You might see coming out of a diesel bus if you're standing behind one or driving behind one. I always seem to end up driving behind the diesel buses. I don't know why that is. And then I'll do anything to pass them. So. To avoid the pollution. I'm probably putting myself in more danger, but anyway, I don't want to get exposed. And then secondary particles, which I'm sure are very relevant here in Israel, where you have so much sunlight, and that's from the gases that are emitted from pollution sources, which then cook in the atmosphere in the presence of sunlight and then form secondary particles in the atmosphere. A good example is sulfur dioxide emitted from power plants. Would then cook in the atmosphere and convert to sulfate particles, like ammonium sulfate. So here's the variety of sources, diesel buses and power plants of the primary sources. Just to give you an idea of what the size of the particles that we're interested in, you can see here a beach sand and a human hair. And then there are many particles of PM10, particulate matter less than 10 micrometers in diameter. And then within each one of those, you can see there are multiple PM2.5 particles less than 2.5 microns or micrometers. And so they're so small that you can't see them individually. So much smaller than the diameter of a human hair. But you can see them collectively when they're in a cloud and they scatter light or absorb light. But you can't see an individual particle in the air, like we have particles right here in the room with us, but we don't see them individually unless perhaps sunlight comes through them and they scatter. Most of the most prevalent size of the fine particles is actually, especially secondary particles, is about 0.6 microns, which is about the same size as the wavelength of visual light. So that's one of the reasons why they interfere with your ability to see, because they just happen to be in the size range that optimally interferes with the light and scatters it and causes haze. So that's a very common size, and we can happen to see them because they happen to be right in the visual range. Now, the larger particles, sort of windblown dust and the like, our bodies have very good defenses against. In the World Trade Center particles after the attack on the World Trade Center, lots of those particles were very, very large. They were very alkaline, but they would be captured by the upper airways. And because large particles will impact, and then people will swallow them or cough them out or sneeze them out. So our body is pretty good at defending against sort of natural particles, ones that we've been exposed to for a long time. That was a big problem with the World Trade Center, was when people got them in their throat, it was alkaline, so they got what they called World Trade Center cough. But the good part of it was that most of those particles were very large and didn't get it into the deep recesses of the lung. And that's with the very small particles, like from combustion particles and from industry, and secondary particles, again, are much smaller, so that they can pass through and really defeat the body's defenses and get through into the deep lung. And the thing about these particles is that they're not only small and therefore can defeat our defenses, but also they have a large surface area. So they have their own toxicity, and then what they do is normally your body would, again, your defenses against gases like sulfur dioxide, they would be absorbed in the upper airways, and they wouldn't get deep into the lung, down into the alveoli, and then to the areas where there's gas transfer into the bloodstream. But what these particles do is that they are enablers. They suck up the gases, and then they are a vector to bring the gases down into the lungs. So they have two purposes, one or two impacts on the body. One is that they themselves have toxicity and get down into the deepest recesses of the lung, but they also carry with them, give a pathway for gases to get by your defenses and carry them down into the lung. So they're sort of a double whammy, as we say in the States. As I was saying, they scatter light. So this is a view of New York, but you can't see from the Palisades on the other side, on the New Jersey side, if people are familiar with the New York area. And that's the George Washington Bridge, but you can't really see any of the buildings. This was a very high pollution day a number of years ago, lots of sulfates, so the scattering of the light. By scattering, it cuts out the contrast, and you're no longer able to see the individual buildings. So that's what's happening. And people would say, oh, that's just fog, but no, it's not just fog, especially when you look at the relative humidity. If it were fog, it would have to be nearly right around 100% relative humidity. But on days like this, it's maybe 40, 50% very dry. So if you know the relative humidity is low, it's not just water. I mean, these particles do condense water on them, so part of them is water. But without the particle, you wouldn't see this. It's sort of like the London fog. I'll talk a little bit about that in a minute. But so what are the impacts that have been shown of particles, of pulmonary effects on the lung, but also cardiovascular, as they can get into the bloodstream. And there are all sorts of toxic, as I said, sulfur compounds and metals. So oxidative stress is a big concern from particles, which can affect your cardiovascular system. We've been finding more and more evidence of developmental effects on in utero children from exposures to moms, as well as neonatal effects, exposures in the first few months of life. So this is a very active field of research, but we're finding more and more suggestive evidence and some definitive evidence of effects to the young and the very young. And nervous system effects, effects on the immunological system, and of course on cancer from long-term exposure of many years. And the World Health Organization just had a designation, you might have followed in the news, saying that air pollution is a level 1 carcinogen. And a lot of that's based on some of the research I'll show you here today. So here's the London fog episodes in the early 50s, and showing how that the death rate in London skyrocketed on the days when particle air pollution went up. Now, this had happened many times before, but this was the first time where researchers happened to be measuring the pollution, and coincidentally, that's when they found the smoke measurements, which was basically black smoke, looking at the filters and seeing how dark they are and how much carbon was in them. And that's the red line, and then the gold line is the mortality, and they go up and down together. And you see the picture here of the typical double two-level bus in London and the fog, and it was, a friend of mine, David Bates, who's now passed away, told us he was there as a physician, and how you could barely see your hand in front of your face. People were bumping into lampposts and things. And this is sort of the Sherlock Holmes fog, pea soup fogs that you see in the movies. But these are all gone now because they controlled the burning of coal. And that was creating particles, and those particles were picking up the moisture and making the fog. So as soon as they got rid of the coal burning, then these pea soup fogs went away. So if you're going to London in the wintertime looking for these fogs, I'm sorry, they're gone. But I think it's probably a good thing. Ruins the atmosphere, but good for your health. And so among, again, the people most affected for these diseases, older adults with pre-existing disease, such as chronic obstructive pulmonary disease, children, as I mentioned, infants, and we've done a lot of studies showing effects of air pollution, especially on children with asthma. And healthy adults who work or exercise outdoors, so that by exercising you get a bigger exposure. You're breathing much more air 5, 6 times as much air per minute, and so you're increasing your dose. And so we've done studies of joggers in New York City and measured their lung function before and after, and found effects. Basically, what you get is there's a benefit of exercising, but the higher the pollution, the benefit actually declines and declines, and then actually gets worse for you to exercise. So the message is, pick your days when you want to go out and exercise. I always tell the story, if I have a minute. A reporter came to me. We did one of these jogging studies in Sterling Forest, where our labs are outside of New York, and we showed how ozone levels, during high ozone levels, that lung function declined in people, and you shouldn't exercise. And so the reporter ran a big story on it, and the message was, on these high pollution alert days, don't exercise. So it ran on a day when it was a pollution alert day. So I called up at lunchtime to congratulate him on running the story in the local newspaper right at the time, so it would help people avoid getting exposed. And they said, no, I'm sorry, he's not here. He's out riding his bike. So reporters don't even believe their own stories. So hopefully others believed it more than he did. Then people with inadequate health care, we do find the poor and the working poor in New York City are the ones who are most affected. So when they don't have good health care insurance, then they tend to not get health care, and then things get worse and worse and worse, and then so their health is not, they're more susceptible. And we find this, in the United States, poverty and race are highly correlated. So when we did a study of ozone, we found the effects among the non-whites to be much higher than among whites, but non-Hispanic whites. But then when we looked by insurance and income, the low income and people without insurance, irrespective of race, were more effective. So what looked like a racial difference really was a socioeconomic difference in having good health care, which we're trying to solve in the United States with a few hiccups now and then. And so this is just the neonatal infants versus older adults. Look at the different ages going across from less than 1 month of age to 1 to 12, neonatal ages, and then the number of deaths in each age group all the way up to 75 plus, and then the week before and the week after the episode and the ratio. And you see that there's nearly a doubling in the less than 1 month age, and about a doubling. But then the ratio goes down and then goes back up in the older. So it's the very young and the very old that were most affected. We do all these high, very involved statistical analyses. But when you have a signal like the London fog, you can see a lot just from very simple statistics, just before, the after divided by before, and you see it comes out very clearly. Fortunately, we don't have pollution levels like that in the Western countries anymore. We've had a lot of analyses, and I won't go into all the studies. We have hundreds of short-term studies, in other words, looking day-to-day variations in pollution and day-to-day variations in health effects like hospital admissions and mortality, and finding a correlation from day to day, and then also looking at places where people who live in places with higher pollution versus lower. So those are long-term studies with a cumulative. And one of them is one I was the PI of the grant on for the American Cancer Society. We looked at the American Cancer Society cohort that started in the early 80s and followed them over the next couple of decades. And that study confirmed past associations more definitively, because we had over 500,000 people across the United States. We had good exposure information because there was a monitoring network that was set up in the US at the beginning in the 1980s under the Carter administration, which was then taken down in following administrations, but then the Clinton administration started it up again. So we had it sort of at the beginning and the end of the study. We had good information about exposures across the US. And it showed really for the first time a very strong association between exposure to fine particle air pollution and lung cancer, which now, 10 years later, the World Health Organization is now acknowledging. As I say here, the 17th of October, the World Health Organization the IARC concluded there's sufficient evidence that exposure to outdoor air pollution causes lung cancer as a group 1. And PM, particulate matter, was a major component, and it was designated carcinogenic. So the Pope et al. Study that I'll show you from our research a decade ago figured strongly in that. And that was published in the Journal of the American Medical Association, and looked into the lung cancer and the cardiopulmonary mortality and long-term exposure to fine particle pollution. We subsequently looked at breaking out that cardiopulmonary into pulmonary and cardiac, and found most of the deaths in the cardiac. So we had, as I said, about 500,000 adult men and women from an existing cohort. So this is what we do a lot of in air pollution. It's very expensive to set up cohort studies and to get the money and then follow them over many years. So what I've tended to do is you find these cohorts that someone's collecting for another purpose, like they were looking into cancer, and they have all the information, and you say, well, okay, let's control for all the variables that they consider, and then see if, after controlling for all those things, whether air pollution can explain any residual mortality. So that's the basic design, and it's a lot cheaper to do because you don't have to do your own cohort study. You can just sort of latch onto one. There are some weaknesses with that you don't always get the exposures you might want. You might select the people differently if you were doing something designed just as an air pollution study, but you have to take what you can get. So with that paper, we followed up through 1998. We've since followed it up further, and we looked at time and cause of death, and then we had personal information collected by questionnaire. We had information on their occupational exposures to control for that, and including exposure to asbestos, chemicals, solvents, coal, etc., tar pitch, and then 9 additional indicator variables of occupational dirtiness that they filled out. And then we had detailed information about smoking, whether they were a never smoker, a present smoker, or someone who was a smoker and now no longer smoked, former smokers, and then a lot of information about their diet, which can be important in terms of whether they have antioxidants or not. Education, which turned out to be a very important variable, that effects are much less in the highly educated versus people with less education. Again, this is related to, if you have higher education, you have generally a higher income. Although, and I've looked at the statistics, and, as you go from getting a high school to then getting a college degree, your income goes up. And then if you get a master's degree, it goes up again. But if you get a PhD, it goes down. So watch out. Don't do what I did, So I think it's largely because they go into education. And the master's people, go into business or something more financially lucrative. But you don't get a PhD for the money, that's for sure. And then marital status and body mass index, and then alcohol consumption. So all these variables were collected by the American Cancer Society, so we used them in our models. And so what we ended up with was you can see here, the relative risk of 1 is sort of at the mean. So that's what we're relative to. We're saying as you go down from the mean, does the risk of death go down? And as you go up from the mean, does the risk of death go up? And you can see that for all cause, there's a steady slope upward. Cardiopulmonary is a little steeper. As lower pollution has a lower risk relative to higher pollution. And then lung cancer, it's even steeper. But then we looked sort of as a control. We looked at all other causes, things that we would have thought less likely to be affected by air pollution. And in fact, you see a flat line. So those causes were less affected than by the pollution than the respiratory and cardiac and lung cancer. So the conclusions were that long-term exposure to fossil fuel combustion, air pollution, and that's because, in part because we looked also at sulfates, and the sulfates were strongly associated as well, and sulfates come from fossil fuel combustion. So based on the evidence that we had for that study, we felt that it was more the combustion particles than any other kind. And I'm working on following up on that to look at that question more deeply. And then, again, for lung cancer, living in a more polluted area is associated with approximately a 20% increase in the risk of dying from lung cancer. So that's roughly comparable to the risk of a non-smoker living with a smoker. But of course, with air pollution, you have no choice. You have to breathe the air that's around. You have a choice whether to live with a smoker if you know, it's up to you. So you have that control. But in air pollution, we really have to breathe the air that's out there, which puts it sort of in a different category. And again, the cancer risk from air pollution seem to be higher in non-smokers and those with lower socioeconomic status, lower education. So here's the follow-up that we did on the cardiovascular, and we found much higher relative risks. You know, we were talking about for a 10 microgram increase, about a 5%, 6% increase in your risk of dying, and a life shortening of a year to 2 years from air pollution. Okay, so pretty dumb reason to shorten your life a couple of years, isn't it? Really totally avoidable if we would just clean the air. But the highest risks were found for ischemic heart disease, and the cardiovascular was much higher than for other causes. Here's a recent study that I wasn't involved in, but was done in Canada. And one of the things with the United States, if we go back here for a second, you'll see that the pollution levels really, it only goes down to about 7, 8 micrograms. So, you know, what happens below that? Are there further benefits? And I could get into the political or the sort of policy-making aspect of it, but people would, some argue that, well, then you can't say that there would be a benefit of even cleaner pollution because you didn't show that in your study. But in Canada, the air is much cleaner, and they've done a cross-sectional study that was published in 2012 in Environmental Health Perspectives. And there, the pollution levels go all the way down to about 1 microgram per meter cubed, so much lower than our study did. And they're showing the same kind of decrease all the way down as low as they can measure. So basically, no matter what level of pollution you're being exposed to, reducing it will reduce your risk. So there doesn't seem to be any threshold below which there's no benefit of cleaning the air. And here's our a pyramid of effects, and this just to get the point across that, you know, mortality, and that's what we study generally because we have good statistics for that everywhere, is just the tip of the iceberg. And then in terms of the severity, you know, the mortality is at the top, but as you go to less severe, you get more and more numbers. So as you go to morbidity, like emergency room visits and doctor's visits, you get much more counts. More people experience those effects than actually die from air pollution. And then physiological changes and, you know, days of work missed and school days missed and illness and that kind of thing have much greater numbers. So it depends if you're saying, well, okay, what's the most severe outcomes of air pollution? Well, it's mortality, but that's a fewer number. But if you start looking at, well, what are the numbers of people who are affected, you get down to morbidity effects and hospital visits and things like that. Then cough and wheeze and symptoms like that, you get much larger numbers. So the lower part is where, the less severe is where you see the greatest numbers of people affected. Now, one of the big issues we have today is, well, okay, particles, but which particles? Which ones are the ones we should control first? Are all of them the same? We don't really think so because they're very different in their composition. And here's something from back in the day of doing my dissertation work, but it's still true that if you look at the distribution of the trace elements, like for residual oil, and we still use vanadium and nickel and sulfur as markers for residual oil combustion. And then if you look at a ferromanganese plant, steel mills operations, you know, steel operations, you get potassium and other metals that are unique. So they have different fingerprints. And so in our research, we're starting to use these fingerprints to differentiate days or places where different sources are affecting more or less. So you can start to say, well, okay, yes, it's, you know, there's a higher risk in places with a higher PM2.5, but it's really in the places where there are certain sources that are the biggest effects. And so then that will help focus control methods or control policies so that they can be most effectively implemented. So you spend your money where you get the biggest bang for your buck, or shekel, depending on your units of currency. And so, you know, fortunately, under the Clinton administration, they set up this whole network across the United States where they're collecting data like I used in my dissertation 20 years earlier. And I was in the fortunate position of having those data because the Harvard six-city study that I was working on went out and collected it for that study. So I was able to take those data and analyze them for sources and evaluate which sources were affecting the people in the various cities from the six-city study. But then, but other people didn't have that kind of information. But now the government, well, it's getting cut now with everything else in the government these days, but fewer sites than we had in the, from 2000 through about 2010. But we have a network all across the United States collecting the information for you to look for these fingerprints of pollution. So why do we think these particles are much more toxic than other kinds of particles? And as I talked about before, these are kind of particles that our body doesn't defend against very well, and they're very small, and they can defeat the body's defenses. And as I mentioned, the diesel particles have been identified also. And as I point out here, they contain irritants and cancer-causing substances like benzoate-pyrene and benzene. So, and there's lots of European and US studies showing higher rates of, for example, asthma near roadways. So it all fits in with some of the evidence that's out there. People have, David Diaz-Sanchez has done work where they've exposed people to diesel particles and found that they get an allergic reaction to it. So, it's actually an allergen as well as a cancer-causing substance. And, in the US, and I don't know here, but we have a growing epidemic of asthma as well as obesity. And they seem to go together to some extent. And so it's a big problem. We did a study in the South Bronx where about a quarter to a third of the children have asthma. So it's very high. So we looked at 4 schools in the Bronx. If you're familiar with New York City, here's Manhattan over here, and here's the Bronx. And the Major Deegan comes down here, and the Bruckner. So a lot of these kids are basically, if you're in the Bronx, you're surrounded by highways all around. So as you move away from one highway, you get closer to another one. It's really nowhere. You can run, but you can't hide. And many of the deliveries where people get trucks into the city, they pass through the Bronx and into New York City. So it's sort of the doorway into New York City, or some would say the doormat for their goods. And we worked with some of the local public interest groups, and we looked at 10 elementary school children with asthma from each of the 4 schools and followed each of them over a month, measuring their pollution exposures and measuring their health, like cough, wheeze, and lung function, measuring day-to-day variation. And we used portable monitors. We gave them backpacks with a little pump in there, and we had a filter so we could collect an integrated particle sampler. And then we had these nephelometers which look at scattering of light. Remember how I said that the particles scatter light and affect the visibility? We'll also use that characteristic in measuring it. So when the light is scattered inside the instrument, then we know there's more particles, and you can calibrate that. So we had sort of a continuous measurement as well as an integrated mass of their exposure, and we could look at that filter for different constituents. Really can't see that. Looks great on my computer. But this is one of the schools, and we had a bus, a mobile vehicle that we monitored pollution, and the city was monitoring. You can sort of see that monitor up here on the top. And we did some comparisons and published those and showed how much higher the pollution levels were on the street where people walk around versus on top of buildings. Yeah, it looks much better over here. The schools were very helpful and gave us space to collect information on the kids on a daily basis. And what we found, was that we looked at the incidence of cough and wheeze, for example, and we noticed that for elemental carbon, the black soot in the particles, as the levels went up, the incidence of cough went up and the incidence of wheeze. We also looked at PM 2.5 overall, and you see sort of the same trend with a lot of scatter, but it's not significant. So it's really these elemental carbon particles that are driving the relationships, and we published that in Environmental Health Perspectives. And one of the things that was noticed was that, and I don't think this was part of that paper, it was part of the dissertation Ariel did, was that really what was driving the effects was the girls. So we find a higher rate of asthma, prevalence of asthma in the boys, but it's really the girls who seem to be most affected by the air pollution, and a number of studies have found this. Actually, it's very interesting. We don't know why. And the people are looking into why that would be, why there'd be a difference between boys and girls, and also with age, pre-menarche, post-menarche, and how much pollution is affecting the girls. So I think that's ongoing research area. And so we found that it was especially the traffic soot particles that affected the kids with asthma, and diesel traffic is a significant contributor to the asthma problems. And then just sort of going to the global part of the talk, the Global Burden of Disease study came out last year in Lancet, and I contributed to this, one of about 1 million authors. I was on the Outdoor Air Pollution Committee, and we looked at outdoor air pollution, particulate matter, and ozone, and their contribution to the burden of disease. Looking at that, we looked at the exposure to outdoor air pollution, and there we used what monitoring was available around the world, and we used satellite data as well as models relating activities to pollution, and putting all that together, coming up with exposures. The previous burden of disease study that was done 10 years early only looked at urban areas, but because we had satellite data, and that's basically half of the world's population. So we were able to double the number of people considered, and the burden, of course, the effects of air pollution increased dramatically for that reason, as well as the fact that pollution levels are going up. Here's a paper that was mentioned earlier, and shows the pollution levels at the various parts of the world. And you can see China and India and Africa all have very high pollution levels, and Western Europe and North America have much lower levels. So the real problem, and the other factor is, and I think I have a slide maybe here, showing while these are going down, these are going up. So, it's worst case kind of scenario. This is the report's results looking for 2010 at the various burden of disease and dietary risks, high blood pressure, tobacco smoking, we're all up here, the top three, but then household air pollution, high body mass, obesity, and ambient particulate matter air pollution. Now, this household air pollution is basically particulate matter. So if you take the outdoor pollution and you add it to the indoor pollution, you're right up with the top three. So it really is a major source, air pollution, either, if you add indoor and outdoor pollution, they're right up in the top three of burden of disease in the world. And then what we're doing is, after we did the global analysis, it's kind of an interesting thing there, and I've been involved with some of the countries. They're rolling out country by country, because they've got every country in the world. So first of all, every one of them is a separate publication. That's a good thing, right? And also, I think it has a much bigger impact. You say, okay, here's our analysis for Great Britain, and all of a sudden everybody in the UK is looking at their results and saying, oh, we're included in this. And North America, we're looking at the United States, had a paper, and one of the ones that got the most press was China. We looked at China, and you're talking about, it came out to about 1.2 million deaths per year from air pollution in China, from outdoor air pollution. And it's showing, the different causes: ischemic heart disease, chronic obstructive pulmonary disease, cerebrovascular disease, lower respiratory infections, and tracheobronchus and lung cancers. So those were the categories that they included. And so what is the pollution in China that's causing this? Well, about half of their pollution is from coal burning. This is from the, I think, trying to remember, I think I got this from some newspaper. I think it was, I'm trying to think, the Wall Street Journal, I think, some highly referenceable document. But they referenced the Deutsche Bank. But I think this is basically correct, that the coal burning is a very important contributor there and a growing problem. So yeah, here's the slide I was thinking of. That this shows the change, and actually the pollution levels have been going down. So this is minus 55 to minus 49% in the deep blue. So you see there's reductions going on, but then you've got big increases, a 50% increase in population-weighted exposure in China. So China's high and getting worse. So I just had a think piece sort of that I was asked to write for Nature, climate change. And in there, I looked at the whole question. There was a paper by West et al., which just came out in September, showing that the benefits, the health benefits of cleaning the air would basically offset the cost of climate change mitigation measures. Just set aside that climate change mitigation might reduce climate change. The health benefits of reducing fossil fuel emissions for the purpose of getting reduced climate change will have significant health benefits, and they're much more local and more immediate than the climate change benefits. And so that was really the purpose of my write-up. I'm saying, the problem with climate change as a policy issue is the most severe potential effects of climate change are decades away, and people have trouble relating to something that's 20, 30, 40 years away. We can't deal with something that's next year, at least in the United States politically. It takes a major crisis. Even though you have to pass a budget, sometimes you just don't do it until the very, very last second. And you should deal with climate change, but, maybe you'll wait too long, And the concern is that it's might be like the Titanic. They saw the iceberg and they tried to stop, but the momentum carried them right in, so it didn't, by the time they saw it, too late. And the other problem with climate change politically is most of the climate benefits are not localized. So the people who would clean up would get really very little more climate benefit than the people who did nothing. So you're expending this money to avoid climate change, and these other guys are getting a free ride. That's not a very popular policy, right? And I think that's been a big problem with China and the United States and other countries sort of saying, well, we're not doing anything until you do something. And they say, well, we're not doing anything until, and so nothing happens. But in contrast, the health benefits and their associated monetary valuations of reducing the emissions of air pollution they occur simultaneously with a reduction in CO2, but they're immediate and they're local. So they sort of pass the test of something that you might actually be able to get something done. If you said, okay, we're going to lower fossil fuel emissions and then we're going to see reductions in adverse health effects locally and within the next year or two. So the benefits are right away and they're local. So the people who do the right thing get the benefits. And so I think, I think I've got the slide from West, yes, showing that the health benefits, if they were to implement the climate mitigation policies that are out there, you'd see some reduction in the pollution and therefore reduction in the health disbenefits, the deaths associated with air pollution. But you can see the places that would reduce the most would get the most benefits. And then looking in 2030, they looked out many years in this paper that I was asked to talk about in the journal, that basically down here are the benefits. There's a range of benefits from maximum to minimum, and then down here is the cost. So these benefits far outweigh the cost of the cleanup. So overall, the research indicates that significant fine particle mortality and morbidity effects, toxicological research, which I really didn't get into too much, but there's lots of toxicology out there. Epidemiology is basically associations, correlations of things, but there's lots of toxicology out there supporting these associations, and so they pass the test of whether the relationship is causal or not. And fossil fuel, my conclusion, fossil fuel combustion, especially coal combustion and diesel soot, appear to be among the most toxic of these components. It's a large, fine particle pollution is a large and growing problem globally. I just really feel that, and this is the point of my writing it, is that clean air policy and climate policy should be harmonized. That when we're looking to clean the air, we should stop and think, well, okay, well, this thing that we're going to do, will this help offset climate? Will it lower CO2 emissions? And similarly, when they're doing climate mitigation, they have a choice of policies. For example, you could plant more trees to capture more CO2, but that's not really going to help the air pollution clean. So you would say, well, what are the policies that we can do for climate mitigation that will also clean the air and get the health benefits? So when we're doing each of these, we should be thinking of the other and trying to optimize them, because you do have a choice. I mean, the example I gave in there was, for a power plant, you could keep burning fossil fuels but put electrostatic precipitator to take the particles out. Well, that's a solution to the PM 2.5, but the CO2 still goes out. So if you switch from fossil fuel to another source of energy, like solar panels and new technologies that we might develop, then you're going to also get the clean air benefits while reducing the CO2. So thank you very much.